Welcome to the International Whaling Commission's Cetacean Strandings Investigation training videos. In this video, we demonstrate best practices for sampling and storing tissues for subsequent microbiological and histopathological examination. Before collecting samples, coordinate with your diagnostic laboratory to establish their preferred sampling protocols. As a quick reminder, the priority tissues to be sampled for bacteriology and histopathology are the lungs, heart, liver, spleen, kidneys, reproductive organs, and, where practical, the brain. Other tissues should be taken from organs where pathology is suspected. Analysis of these samples can help determine the cause of stranding and inform our understanding of disease ecology. Microbiological examinations can identify infectious agents and quantify their burden, as well as characterize tissue-level alterations associated with health and disease. Histopathological analysis helps visualize tissue-level alterations associated with health and disease. Before sampling, assemble all required equipment. Handle tissues carefully to prevent contamination and use sterile instruments and containers to preserve specimens for subsequent microbiological analysis. If permitted by your laboratory, the simplest approach is to collect a tissue block of at least 3 centimeters cubed. Handle it aseptically and submit it chilled or frozen, properly bagged and labeled for bacteriological culture. For bacteriology, always sample from uncontaminated tissue. If possible, sear the outer surface of the organ using a clean, heated spatula or blade immediately prior to sampling. This destroys any surface contamination. Then, use a sterile scalpel to make a small incision into the tissue and insert a sterile swab into the freshly exposed interior. Rotate the swab gently to collect material from within the organ. Immediately transfer the swabs into an appropriate sterile transport medium, or, if unavailable, just a sterile dry tube. Label the tube clearly with species, organ, date, and case ID using indelible ink. Be sure to use a fresh, sterile blade and swab for every new site sampled. Maintain the cold chain for all bacteriological samples. Store them between 0 and 4 degrees and transfer to -80 degrees as soon as possible. If immediate culture is planned, do not freeze. However, if culture is to be delayed, freeze as cold as possible. Histopathology allows microscopic examination of tissues to identify and understand disease processes. To ensure good results, handle tissues gently to avoid introducing crush artifacts. Cut slices no thicker than 1 centimeter. Thicker pieces will not fix properly and will begin to break down. Use appropriate protective equipment and follow safety procedures when handling tissues and formalin. Use at least 10 times the tissue volume of fixative, ideally 10% neutral buffered formalin. Place each thin slice into the fixative to allow quick and easy fixation. Ensure the tissue is fully submerged. Accurate labeling is essential. Each container must show the case ID, species, organ, tissue type, fixative, date, and collector's initials. Illegible or incomplete labels can render the samples unusable. Careful handling, proper fixation, and meticulous documentation ensure reliable diagnostic outcomes. The next video in this series will cover the process of examining the gastrointestinal tract.